Former CDC Director to be grilled over account of firing by RFK Jr. You know, I watched this 3 hours long live, and here I am going to tell you what happened so that you do not have to watch 3 hours long. The Senate's Help Committee convened to examine why Dr. Susan Monterez, the first ever Senate-confirmed CDC director, was fired just 29 days after being sworn in, and what that episode says about how health policy is being made under HHS Secretary Robert F. Kennedy Jr. The framing divided quickly into two stories. One, offered by Ranking Member Bernie Sanders and reinforced by Dr. Monterez and former CDC Chief Medical Officer Dr. Deborah Houry, was that Monterez was pushed out because she refused to pre-approve vaccine policy without seeing the science and refused to fire career experts on command. The other, suggested by some Republican members, was that the CDC had forfeited public trust during COVID and that new leadership and new advisory voices were needed to course correct, even if that meant aggressive changes. Dr. Monterez's testimony was straightforward and pointed. She said that on August 25th, the secretary demanded two things. First, that she commit in advance to sign off on whatever the CDC's Vaccine Advisory Committee, ACIP, recommended, regardless of the scientific evidence. And second, that she dismiss career officials responsible for vaccine policy without cause. When she refused, she says he told her he had already spoken to the White House about removing her. She also testified that she was told to stop speaking directly with senators, to route her policy and personnel decisions through political staff, and to work only with political appointees at CDC rather than career scientists.
In a world saturated with information, finding the truth requires unwavering dedication and independent voices. America Facticity stands as a beacon for factual, unbiased reporting, delivering the stories that truly matter. Join our membership for just $9 a month. Your support helps us grow our team and create even better content. Find the link in the description below.
Thank you, Senator Murkowski, and thanks to our witnesses for being here today. Dr. Monterez, I owe you an apology. When you were here for your confirmation hearing, I questioned you very significantly, not on your qualifications. You got over the qualifications bar easily, but my worries about the direction of HHS made me question you very significantly on your backbone.
You did?
A trait that is not in long supply in this town. And then when I voted against your confirmation, I cited that as the reason. Again, no concern about your qualifications. I had concern about your backbone, and I was wrong. And I apologize to you for being wrong. I think it's important when you're wrong to admit you're wrong. I want to ask you a question to follow up on an answer you gave to Senator Baldwin, and I'm not sure I heard it right, but were you instructed by the Secretary of HHS to not speak to senators?
I was instructed to not speak directly with senators.
And was that also in the August 25th meeting you described?
That was over the course. I had several engagements with the Secretary over that day, and it was in one of those meetings that I was instructed.
So confirmed CDC Director, Senate confirmed. We used to speak with the CDC Director all the time during COVID and during other emergencies, instructed not to speak to senators. Is my memory right? Doesn't Secretary Kennedy say he's about radical transparency?
That is one of the areas he has prioritized.
Yeah, well, putting a gag order on a CDC director and directing her not to speak to those who have confirmed her and to whom she is responsible for oversight is a very serious matter. I want to talk about measles and finish with a question for Dr. Houry. Just really get in the minutia about measles. 1,454 cases in the U.S., 4 in Virginia, and I'm just going to give you about the most recent one in Virginia. School-age child, early September, 5 to 12 years old. Measles is really contagious, spreads through the air. You can contract measles when somebody has had it in a room even 2 hours after they've gone from the room. Mm-hmm. And you often don't show symptoms for days. When this child with measles was identified and the case was reported to public health officials, our Virginia Department of Health had to spring into action. They had to find potential exposure. The child, while infected but before demonstrating symptoms, had attended school for 1 day and had visited multiple healthcare facilities. In 1 day, 1,000 Virginians were exposed to measles by this one child. The VDH coordinated with the healthcare community and the school district to contract trace 1,000 people, followed up with 800 people, including babies in a NICU too young to be vaccinated, had repeated contacts with these individuals to make sure that they weren't showing symptoms. The VDH has dozens of staff, about 50 were working on this issue. And within days of the knowledge of the case, the VDH had worked to notify all 1,000 people. Now they have to continue to monitor for another 21 days. 45 to 50 officials had to work just on this one case. I'm very proud of their work. And I'm sharing the background just so people understand how serious even one case of measles is. The Infectious Disease Society of America says the median cost for a health department to respond to one case of measles is $32,000. So just multiply that by the 1,454 cases this year, $46,464,000 already to respond to measles, which is at a rate that we haven't seen in a number of years. A case costs a median of $3,200, but the price increases as you're trying to contact trace. The median price to contact trace is $223. So for Virginia, just to contact trace 1,000 people, $223,000 for one case.
She added that she was told to expect changes to the childhood vaccine schedule starting in September and to be on board, even though no evidence had been presented to her to justify those changes. At one point, she was asked to meet with outside vaccine litigation figure Aaron Siri. Her bottom line was that she could have kept the title by yielding to political demands, but she would have lost her integrity and put public health at risk. Dr. Hurry's testimony focused on process and consequences. She said HHS removed all 17 voting members of ACIP and halted the work groups that usually produce the evidence reviews, leaving only one work group for COVID. She described pediatric flu campaigns being paused despite a high non-pandemic season death toll among unvaccinated kids, and she warned that international surveillance samples for flu and COVID had dropped steeply, reducing the nation's early warning visibility. She said she first learned of major CDC COVID guidance changes from social media rather than internal briefings, and that when CDC asked HHS for the data behind those changes, none was provided to them. She also described political interference in what scientific material could appear on CDC platforms. For example, removing a CDC science document on thimerosal while allowing an unvetted outside presentation on the topic at ACIP. In her view, the pattern was clear. Gold standard scientific process was being compressed or bypassed, and that would cost lives. Several senators drilled into specific episodes. Both witnesses recounted the shock at the August 8th shooting at CDC's Atlanta campus, in which hundreds of rounds were fired and Officer David Rose was killed. Howry said the climate has grown so volatile that some scientists have taken their names off papers and stopped presenting publicly for fear of being targeted. Senator Baldwin pressed who was setting ACP's agenda. The answer pointed to HHS political staff, not the usual scientist-led work streams.
I just entered into the record the op-ed from the Secretary and your report, and both of those suggest that you and Secretary Kennedy were actually pretty aligned upon CDC priorities. How many times did you meet with the Secretary in your 29 days? Be brief, I've got 5 minutes. Are you on?
Yes, can you hear me? I met with him twice. When he swore me in, he was in the room, he swore me in. And then I met him again on August 11th when he came down to tour the buildings that had been under the gunfire. And we chatted briefly.
And then you met the 25th as well?
And then the 25th, that's correct, yes.
Okay, and how many meetings were around the period of the 25th?
We had 3 distinct meetings that day.
Okay, and what did he tell you to do?
In the first meeting.
Yeah.
Briefly, in the first meeting, he asked me to commit to firing scientists or resign. He asked me to pre-commit to signing off on each and one of the forthcoming ACIP recommendations, regardless of whether or not there was scientific evidence.
And what were those recommendations? Did you have a foreshadowing of what they would be?
I did not. We did not get into any substance about what those...
He wanted you to approve them?
He just wanted blanket approval.
Okay.
And if I could not commit to approval of each and every one of the recommendations that would be forthcoming, I needed to resign. I did not resign, and that is when he told me he had already spoken to the White House about having me removed.
Did he ever communicate he was going to change the childhood vaccination schedule?
Not until that very day. In that morning meeting, he said that the childhood vaccine schedule would be changing starting in September, and I needed to be on board with it.
Did he ever suggest that that he was speaking for the president?
In that morning meeting, he did say that he had spoken to the president. He spoke to the president every day about changing the childhood vaccine schedule.
Okay. Did Secretary Kennedy ask you to speak to anybody outside of HHS?
He did. In the second meeting that day, he indicated that one of his colleagues or collaborators, I don't know what the relationship is, was coming into town the following week, and he wanted me to meet with that person.
Who was that person?
The person was named Aaron Siri.
Aaron Siri, is he the trial attorney who wanted to get rid of the polio vaccine, allegedly, and President Trump slapped him down and said he couldn't do that? Is that the same Aaron Siri?
I don't know the second part of that, but I do know that there were public reports that he is the individual who had suggested getting rid of the polio vaccine.
Okay. Now, Secretary Kennedy told the Finance Committee that he did not ask you to pre-approve, but that you were biased against the new ACIP, and he just asked you to keep an open mind. Did he cite any data or science as relates to the potential ACIP recommendations to persuade you to support them?
He did not have any data or science to point to. As a matter of fact, we got into an exchange where I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule. And he elaborated that CDC had never collected the science or the data to make it available related to the safety and efficacy.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
Senator Collins asked whether it was normal for a CDC director to be required to clear policy and personnel through political handlers. Monarez said it was not her experience before this August. Senator Hassan asked whether the secretary had expressed condolences during the August 25th meeting. Monarez said he had not. Senator Caney, who had voted against Monarez's confirmation, publicly apologized, saying she had shown the backbone he doubted, and then detailed how one measles case can trigger 1,000 contact traces and six-figure public health costs just as state grants are being cut. Senator Murphy ran a checklist, replace an entire advisory board, pre-approve recommendations, sight unseen, insert political staff between scientists and leadership, and kept getting the same answer. Not normal in prior years. Senator Kim elicited that the plan for compliance described to Monarez was to fire leadership, promote deputies, and keep firing down the line until people agreed to the demands. That is not how scientific independence is supposed to work. Other exchanges underscored the policy fights underneath the process fight. Senator Rand Paul argued that for children, the COVID-19 vaccine's benefits are too small to justify risks, and pressed a long-standing critique of the universal hepatitis B birth dose, asking why a newborn should receive it if the mother tests negative. Later, other members and witnesses stressed why the universal policy exists. Tests can be missed, documentation can be wrong, and infants who acquire hepatitis B have a very high risk of lifelong infection that can lead to cirrhosis and liver cancer. Universal birth dose policies are what drove perinatal transmission down. That debate matters because ACIP is scheduled to meet the very next day to consider changes to childhood schedules, including the hepatitis B birth dose, MMR and varicella timing, and COVID guidance for children and pregnancy. Both witnesses said they had not been shown new evidence justifying a reversal of the birth dose standard, and expressed concern that recommendations were being pre-decided. The committee also sparred over a supposed recording of the crucial August 25th meeting. One senator initially claimed a recording existed, then later acknowledged he was mistaken. The chair asked HHS to turn over any records if they exist, and noted the committee had already requested documents and communications to understand what happened. If radical transparency is the governing principle, members argued, making the full record available would honor that promise.
Would you say that it's harmful to the public if the secretary is not informed by experts like yourself?
Very much so.
How would you characterize Secretary Kennedy's approach to working with scientific experts at the CDC?
You know, we would have loved to have had the conversations with him. I offered to 2 different HHS leaders that we would like to brief the secretary. He never received that, and many times I would send emails to our leadership team to share with HHS when he did say things that weren't scientifically correct so that we could help support him. But again, our requests were not received to brief him.
Ariel, there's clear public distrust of vaccines, of our public health system. This is something that lawmakers on both sides of the aisle want to restore confidence in, especially after the COVID-19 pandemic that helped erode some of that trust. And you did hear some politicization in this hearing today. You heard some Republicans try to question her on her timeline, try to question her on her facts, also trying to question why she went to Cassidy, who is the Republican chairman of this panel, in the first place. Cassidy, I thought, was notable in defending her. He said it's completely appropriate, his words, as the committee that has oversight of the CDC, the Health Committee, in which this hearing is taking place, for people to go and try and sort of sound the alarm in what is happening behind the scenes. And Cassidy mentioned this came at great public risk to Menarez and to Deborah Oury to come and sit before this panel amid such a heightened moment of politicization and polarization in this country, Ariel.
Certainly in the environment and the climate we are living in. Julie, thank you for your reporting. I know you have more to do, so we'll let you go here. Doctor, I do want to play part of an exchange about the childhood vaccine schedule. Let's listen to it. I want your thoughts.
We got into an exchange where I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule. And he elaborated that CDC had never collected the science or the data to make it available related to the safety and efficacy.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
Threaded through the hearing was the word that matters most in public health: trust. Sanders emphasized that virtually every major medical organization regards vaccines as safe and effective, and warned that politicizing the process will bring back preventable disease. Cassidy kept returning to the Senate's new responsibility in confirming a CDC director and what it means if that director cannot protect evidence-based practice for even a month. Members in both parties spoke to families living with measles exposure notices and pediatricians trying to counsel parents when the ground keeps shifting. And Menarez and Oury, one fired, one resigned, offered the same refrain: the fastest way to destroy trust is to short-circuit the very processes designed to earn it in public. Practically everything points to the ACIP meeting. If the committee operates in the open with posted evidence packets, transparent modeling assumptions, genuine public comment, and presentations by subject matter experts, then even contentious decisions can be understood, debated, and implemented with confidence. If the process is rushed, data are thin or hidden until the last minute, and political aides are in the presenter's chair, then every recommendation will be contested in courts of opinion, state houses, insurers, pharmacies, and pediatric offices, and outbreaks will exploit the confusion. By the end, the hearing hadn't reinstated anyone or settled every claim, but it clarified the choices. You can demand speed from a public health agency, or you can demand rigor, but the only way you get both is by protecting the machinery that makes the recommendations boringly excellent. Independent work groups, early and public evidence, clear conflicts rules, deliberations you can watch, and leadership that refuses to pre-approve the science before the science exists. That was Menarez's point when she said she could have kept the office and lost her integrity. It was Oury's point when she said that pausing campaigns, gutting surveillance, and sidelining experts will leave the country less prepared for the next outbreak, not more. And it was the committee's point when it asked for every document, and if it exists, every recording. If radical transparency is real, prove it. The rest will follow.
And remember, if you like what you see, hit that subscribe button.